This Surviving the Stigma community conversation is presented by Momentum Professional Strategy Partners, Elevate Black Wellness in their Partners Therapy Fund Foundation, and Vocal WA. It is also made in collaboration with the Washington State Department of Health through a grant made available from the Centers for Disease Control and Prevention. The community conversation opens with the founder of Momentum Professional Strategy Partners, Christina Blocker, giving a run-through of the Zoom accessibility features before continuing the rest of the program.
Translate. And I also would just like you all to know that ASL interpretation and our live captions will be available all throughout our event, and our interpreters will be spotlighted alongside our speakers. You all just heard that we are having this call recorded, so if for any reason you have to, you would like to refer back to this call, or there was a portion of this call that spoke to you, please note that we are recording this and we'll be providing the replay back to you all after the call is finished. All right, our last piece of bookkeeping and housekeeping is our Zoom navigation process that you see here on the screen. And so you have here the tools for how to access live English captioning, where you can select it. And so if you see the CC button there in the tabs, you can click on that. You'll see how to access subtitles, and you'll also be able to see how you can hide the subtitles or adjust the size of the captions or subtitles should you need them. All right. So I'm gonna transition to Christian Bell, who is our amazing communications director here at the Momentum Professional Strategy Partner team.
Wonderful. Thank you so much, Christina, for the introduction. Hello, everyone. My name is Christian Bell. I'm the Director of Communications for Momentum Professional Strategy Partners, as well as Elevate Black Wellness. And I'll be reading some of our acknowledgments today, which includes our labor acknowledgement, our land acknowledgement, as well as our partnership acknowledgement. We would like to take time to express our gratitude to the 29 federally recognized tribes throughout Washington State. We also would like to recognize the Duwamish, Wanapum, and Chinook tribes, who are not recognized by the U.S. federal government, but have a long history in Washington State. We acknowledge that the land on which we gather and work is the traditional territory of the indigenous peoples who have stewarded and called this land home for thousands of years, and express our gratitude for their custodianship of the land, waters, and resources that sustain us all. We are committed to learning from and supporting their ongoing struggles for sovereignty and fostering meaningful relationships based on respect, reciprocity, and mutual understanding. We also acknowledge the significant contributions and resilience of Black and African American people in shaping the history, culture, and labor force of Washington State. From the early days of exploration to the present, they have played a vital role in building communities, advocating for justice, and enriching our diverse society. We recognize the labor of Black and African American people, both free and enslaved, who labored on the land, in industries, and within institutions. Their contributions and sacrifices have been instrumental in shaping the growth and prosperity of this region. We commit ourselves to amplifying Black and African American voices, stories, and experiences into fostering an environment of equity, inclusion, and justice. We strive to learn from the past, engage in honest dialogue, and work towards dismantling systemic barriers that have perpetuated inequality. As we move forward, let us honor the land, labor, and cultural heritages of Black and African Americans in Washington state and actively support the ongoing fight for equity and justice. Together, we can create a more inclusive and equitable future for all. I'll now move into our partnership acknowledgement. This work is made possible in part by the Washington State Department of Health through a grant for the Centers for Disease Control and Prevention. The grant funding and partnership has been a cornerstone of our endeavors, allowing us to empower communities, champion this health-focused initiative, and make tangible differences where it matters most. So thank you so much to the Washington State Department of Health.
Again, thank you so much, Christian.
Good afternoon. I'm not trying to interrupt you guys, but I'm also the other ASL interpreter. Can you please spotlight me? I would appreciate it.
Thank you. Is this Connie?
Yes.
Oh, okay. Thank you, Connie. We were able to have our original booked interpreters arrive. So we do have Vern and Billy here. So yes, you are free to log off or you're welcome to stay and enjoy our conversation today.
Thank you.
You're welcome. Bye-bye.
Awesome. Thank you so much. Well, again, thank you all for joining us for today's conversation. I am just so honored that we are taking the time today to talk about destigmatizing AIDS. This conversation is really, it hits really close to home for me. I don't share this with a lot of folks, and not because it's something that I'm ashamed of, but it's something that I've been working through in my own journey and healing and grief. But when I was 6, my father passed away with AIDS. And I didn't find out for quite a long time because of the stigma. Some of my family members didn't know. I didn't know. And so when I think about the power that is in this room today, where we are having a conversation about removing the stigma, about embracing and loving on our community members who are doing such amazing work, but also creating space that let them know you belong, we love you, we want to support you. When I think about the power of that and the power of the folks that we might have lost and the folks that we have lost who didn't get to feel that warm embrace, who didn't get to feel that feeling of belonging. I just want you all to know, you being here, you all creating space for us to love and empower and embrace our community is powerful. What we can do with what is in this room here today can change our landscape for how we talk about wellness, for how we talk about community, and how we talk about support. So I just wanted to let you all know how much we appreciate you for being here with us in this space, to create this space of belonging, to create this space of support, to create a space of community. So I am really honored to be doing this amazing work with our outstanding co-hosts from the Therapy Fund Foundation and Vocal WA. So first we have Ashley McGirt. Ashley, do you want to say hi to our amazing folks here?
I am so excited to be here and be in community with all of you. As mentioned, there is so much power in this room, in this space. So I really just want to acknowledge you for being here on a Friday when there's so many other places you could have chosen to be, but you chose to be here with us, and that speaks volumes. As mentioned, my name is Ashley McGirt. My pronouns are she, her, and I'm a licensed mental health therapist. I am also the CEO and founder of the Therapy Fund Foundation, a nonprofit dedicated toward eliminating barriers to Black healing. Most people know us for providing free therapy, but we do so much more. We offer tuition assistance because we and by adding funding that will increase the number of Black clinicians throughout the world. We also offer peer support services, mental health education, and advocacy. At the Therapy Fund, we are working toward creating health equity through addressing structural barriers currently in place that lead to poor outcomes of Black community members' mental health. We made history by hosting the first and only behavioral health conference that is Black-led and dedicated toward improving mental health outcomes for communities of color right here in Washington. History. I want to congratulate Elevate Black Wellness on advancing Black history and achieving the historic proclamation of Black Wellness this week. So if we can just celebrate these historic moments this Black History Month and clap it up, I really want to just celebrate that. And lastly, as I wrap it up, just remember that you matter. Your wellness is important, and it is important for us as Black people to literally reclaim our wellness, which is our birthright that has been stolen from us through colonization, racism, and systemic oppression. And now I want to hand it over to Malika. Thank you.
Thank you, Ashley. My name is Malika Lamont, and I am the director of Vocal Washington. That stands for Voices of Community Activists and Leaders Washington. We work to build power with people that have been impacted by mass incarceration, the war on drugs, HIV and AIDS, and homelessness. And we are very pleased to be a part of this endeavor today. We work to with folks at the margins and at the intersections of all the issues that I mentioned earlier. And we try to create space and place through community for folks that have been negatively impacted by the unfair beliefs that society puts upon them through the stigmatization of individuals by our systems. And so we're just really grateful to be a part of this effort today and to support individuals. And we invite you to learn more about our political advocacy, the safety meetings that have been hosted by our community organizer in Seattle around responding to gun violence and other safety concerns. And we also invite you to learn more about the Overdose Emergency Innovative Recovery Workgroup report that we put out in 2021 that is still very relevant to the issues that we are experiencing now and the disparate level of impact on Black communities of overdose death by opioids. Thank you, everyone, for this opportunity, and I hope that we are able to join together in love and community, as Christina mentioned earlier.
I'll take it from here. Hello, everybody. My name is Deontay Damper, pronouns he, him, his. I'm the community organizer for Vocal Washington. And I just want to say, Malika said a mouthful in the areas of what we do with Vocal, but I just want to just say how happy I am to see you all here. The event is Surviving the Stigma. And I know we did a land acknowledgement, but when I think about surviving the stigma, I think about the community members and organizers who set the tone and who are no longer with us, such as Dr. Stefan Wallace, such as Kitty Jo McMullen, such as Raymond Dumas, who started the Brother to Brother program, such as Imani Woods. I think of them and I'm so grateful, not just for the tone that they set for us, but the speakers that you'll hear today are tone setters in their own right. We are so happy to have them today, and we're so happy to be standing together in surviving the stigma and showing up for one another. I will now pass it back to Christina.
Thank you so much, Deontay. Now I am excited to introduce our speakers. All right, the first person that we have is Aria Albert. Arya is a Black trans femme singer and songwriter, pastor, hostess, event MC, actor, and all-around talented, charismatic entertainer from Montgomery, Alabama. Arya has a deep love for equity and supporting local nonprofits that are bringing resources and programming to communities that have been historically excluded. Arya, we are so excited to connect with you today and listen to you and learn from you. Thank you for joining us. Next, we have Kurt. And Kurt is the Director of Public Health Equity at the Urban League Metropolitan Seattle in Seattle, Washington. As Public Health Equity Director, Kurt leads the engagement of direct healthcare services, capacity building, and community development for the Urban League of Seattle. Kurt, we are so excited and honored for you to be with us as well. And thank you in the chat, Araya. I apologize, Araya. I will make sure to pronounce your name in the way that it is supposed to be pronounced. So thank you for sharing that in the chat, Araya. Next, we have Andrew. Andrew is a proud Nigerian American who was born in the vibrant Houston, Texas. Growing up in the culturally rich atmosphere of his Nigerian heritage and the dynamic blend of Houston's diverse communities, Andrew developed a deep appreciation for diversity from a very young age. Through his advocacy and leadership, he inspires others to embrace diversity and work towards a more inclusive and a compassionate society. We also have Ernest. Ernest is the programs director from POCAN, POCAAN. Ernest has over a decade of accomplishments, starting with the health and social needs of people impacted by HIV/AIDS. He started his public health and human services career in Seattle as a program coordinator of People of Color Against AIDS Network and manager of the prevention programs at Minority AIDS Project in Los Angeles. Most recently, Ernest served as a co-executive director of Lost and Found Youth, an Atlanta-based community-based organization focused on addressing the needs of homeless youth, and was the interim director of NAESM, which is another Atlanta-based organization addressing the health and wellness issues confronted by Black gay men through advocacy, services, and education. We are so honored to have you with us, Ernest, and our amazing speakers. So we're going to go ahead and hop right in. I'm again so thankful that you all are able to join us today. And just so you all, as part of our audience, have a sense of our conversation, we're going to open up with a group question, but you all are going to have the opportunity to listen to and hear from our speakers individually as they answer real targeted questions based on their experiences and based on their journeys. So I'm going to start off with our very first question here, which is to everyone, every one of our presenters and speakers. Can you recall any hesitancies, challenges, or triumphs you encountered during the COVID-19 pandemic, either personally or professionally? And then the follow-up question to that would be, would you say the layer of living or being impacted by HIV/AIDS made the experience more or less difficult? So it's a two-pronged question that we will also drop into the chat. So the first part of the question is, can you recall any hesitancies, challenges, or triumphs you encountered during the COVID-19 pandemic, either personally or professionally? And how about we'll start off, Ernest, can we start off with you?
Absolutely. Absolutely. Yes, yes, yes. I think over the years, especially starting with the whole thing around COVID, just dropping in and really combating, a lot of our biggest fears when it comes to, not having a clue how things are going to play out. You know, at the time I was living in LA, and so I ran a drop-in center in South Central LA. And one of the things that we were tasked to do was to triage and create a vaccine, but mainly COVID testing facility. They were at the time, folks had to get tested on Monday in order to work for the whole week. And so we were able to triage hundreds of African Americans and Hispanic folks to get tested so that they can go back to work. I think that was one of our biggest triumphs, is that we were testing hundreds of people a week, just really getting them, able to go back to work and to work. But also, we saw the community come together with also bringing food and water for people standing in lines for hours at a time, right? I think that really showed that, we made an impact on the community, and they came out to support us in the work that we were doing.
That's beautiful. Thank you so much for sharing, Ernest. I'm going to pass it over to Araya. Araya, would you like to share?
So I am originally from Montgomery, Alabama, and I'm sorry, please forgive me. Being over in the South at the time, I was working in public relations. I'm doing work in community relation, give in corporate giving, and it wasn't a necessary piece for the company to keep going, right? So when you get into this pandemic, the first thing that happens is organizations and companies go to skeleton crews, and in real time, I had to experience what it was like waiting on unemployment to hit because I wasn't going to get my salary paycheck that I was used to. I had to experience still having to pay the same bills, because it took a while for things to shift and change down south. So I think that the pandemic was kind of my first experience in adulthood, of having to kind of juggle what it was like to figure out how to make it, because I was blessed to walk into a career at 21 years old, and so it's like, okay, I can do this. I made it to what was in our community seen as one of the best jobs. I worked for the third largest employer of the state. So it was a jolting experience, but it also helped me because when I came here, when I got to a community that I could serve in and be served by, honestly, it allowed me to see other pieces of humanity and other pieces of the struggle and the experience. And so when people came into our offices, because I started working over there with Pocan, Ernest was my first programs director. And so coming into the space and getting to work with community, it was okay that I had an experience and I understood what this was like. So now I understand what it's going to be like when it's time for us to walk through the steps of coming out of the aftermath of life and traumas and pandemic and walking into sustainable holistic living. And I don't remember the second half, but that's what I have for the first.
I loved your response, and you covered all the bases. So thank you so much, Araya. All right, we're going to transition to Kurt.
Okay. Well, my name is Kurt. Preferred gender pronouns are he, him. And the first question, hindrances. I think it's two things that I dealt with personally, but also that I saw community impacted by, which was the feeling of instability and not knowing what to do with that. Because I come from Baltimore, Maryland. I'm not originally from Seattle. So we're used to always just moving and just getting things done. So to kind of just stop at a complete halt and not know where your next dollar is coming from, and then dealing with COVID and not knowing much about COVID. So then also instability connected with lack of education on something that's happening in real time. That was a lot. And it was a lot for me because I've been working in public health for over 14 years, and specifically within HIV and prevention work, and then having to shift my focus on a live pandemic, and I know nothing about it, and having to come up with solutions, and I myself am being impacted by it. So that, on top of having community members that are living or impacted by HIV on top of a pandemic, was just a whole new slew of just trying to experience what holistic health really is going to look like in real time, and how we can give folks real solutions instead of giving them these frivolous solutions that really weren't going to help anyone, from getting obtainable housing to being able to get health insurance, to know how to navigate through the healthcare system. being able to create language for people to be educated on COVID. So I would say the lack of education on COVID in the beginning and in the midst of it always developing, along with just now having to adapt to the sense of being uncertain when your next dollar was coming from. So to Araya's point. And I think when it comes to some of the things that have greatly impacted folks that are either living with HIV or either have been impacted by HIV, one of the things that I've seen is that there's been a lack of representation. And that specifically here within Washington State, coming from a city where it's predominantly Black and brown, and then coming here where it's predominantly white, and there are services and organizations that offer an array of services, but those services are not being created by those folks that are greatly impacted by this, but they're created by folks that actually are just simply writing what they assume community wants, has been interesting to me. So I would say the lack of community involvement and initiation for program implementation when it comes to HIV prevention and treatment.
Thank you so much for sharing that, Kurt. I wanted to just center on what you said, the lack of representation. I know so many of us on this call, Black folks on this call, we look for ourselves. We look for ourselves in different spaces. When we're looking for ourselves, that creates a sense of community, right? Going back to what we talked about, creating that sense of belonging, knowing that you see me, right? You understand me. You connect with my experience. I appreciate you for highlighting that, but also highlighting how impacted you saw, and you had to navigate strategies to support folks alongside yourself as you were navigating the pandemic and COVID-19 as it was evolving and changing. Just thank you. Thank you for sharing your experience. We're going to transition to Andrew.
Hi, I'm Andrew Ashofu, he, him pronoun. For me, the very first thing that came to my mind as someone living with HIV was my health. Am I going to die? The impact of the virus on people living with HIV. And then the next thing was my medication, because prior to then, I would always have to go to the pharmacy in person to pick up medication. So access to healthcare was a very scary thing for me because everything is locked down. Moving around was difficult. Public transportation to healthcare was very limited, especially for people that don't live within the vicinity of Seattle as a whole. So I was very worried about surviving before we now talk about the financial impact. And I think that's what stirred me. And during that period, we also had the impact of Black Lives Matter, the racism that came along. And so for me, it was an awakening. And that's when I decided that if I'm going through this, there's definitely lots of people in the community going through this. And I searched and I joined the Seattle King County Planning Council. And, one thing that has been brought up is representation, representation, representation. And I am glad that I joined it because a lot of the services were very cisgender, white male centered. And being able to be on the table saying, this might work for you, but for the community I come from, that's not going to work for us. This is what we need. And then another thing that really helped a lot was I was able to be on the Washington State Department of Health COVID collaboration, where I represented the LGBTQ plus people. And also being able to say, if we're doing the vaccine, bringing the concerns, like the impact of the vaccine on people living with HIV, what are the requirements, like my CD4 counts, people's, and then also reaching out to the homeless people that are also living with HIV that might not have access, the social determinants to health, to COVID vaccines. And so for me was, how can everyone that doesn't have the privilege be represented and also have access to what is needed at that moment?
Thank you so much, Andrew. I really appreciated you sharing your experiences, especially going through COVID, and also just your collaboration with systems to really create change, to create and add to voices that our voice, to add to the perspective that's shared, to add to the policies that are being made. So thank you so, so much. So I'm going to transition to our next question, and before we start off, I would love for you. I'm going to start off with you, Andrew. I want to give you the opportunity to really talk about a bit of your work, and then I'll transition into my question for you today. But I'd love for you to share with our audience more about your work, maybe a little bit more about your background.
Wow. So for me, my journey, I guess, started. I was actually diagnosed with AIDS. So it wasn't like um you're HIV positive. It was you have AIDS, and if you don't get this treated, you have like 6 months to survive. And it was a very dark moment in my life because I was also facing homelessness at the same time. It was during the last massive recession. I had no job. I was in Chicago. I went for a job, and a week before I was to resume, they cut off the job. And so I was stranded in the city, homeless, falling sick, and diagnosed with AIDS. And it was, the first thing that comes to mind is, oh, everyone is right. Being gay would lead you to AIDS. And that was the first stigma I had to overcome, was not letting that get to me, knowing that as long as I am alive, there is hope for a better future. And I'm really grateful to small programs like, back then I could only see my doctor on the third Monday of every month at 3 p.m. I would only be given transportation to go wherever I'm going and come back. Sometimes that was the only time I would even have access to a lot of things. And my first time I had to take medication, I had to call a friend, and I was crying on the phone because I had to take so many pills. And I was like, this is what my life would be. But because I went through that, I made a vow that no one should go through that same thing. What can we do? What can I do to ensure that this doesn't happen to people? That resources are there so that someone should not be told you have 6 months to live to be diagnosed. And that's why I became very vocal. Right now, for my job, I'm a sexual health program manager at Health Point Clinic. And I'm also the co-chair of the the Seattle King County TGA HIV Planning Council. And that planning council, we are the ones that deal with the Ryan White Part A funding from HRSA and CDC to Washington State. And we take care of King County, Island County, and Snohomish. And what we do is we build the budget of where money should go. We also determine the guidelines to services that agencies that receive money from Ryan White Part A should do. And one of the greatest things I'm proud of is in the first 6 months of me being there, I was able to change our food program. From my experience, and I said when I was going to food places, they gave me food that I had no idea what to do because it wasn't my culture. And so now, because of my work there, every agency that takes money for food, they have to provide diverse cultural food, ethnic food, religious based. Everyone's religion is respected and services for them, and also special needs. And when I was fighting for this, I said, food is part of health. And I realized that I would not be where I am without the right nutrition, especially when I was diagnosed with AIDS. And for me, speaking up is I want people to see I am HIV positive. My life did not end. And also the stigma of being gay, of being Black, of being immigrant is not a barrier to survival.
Thank you so, so much. When I say there is so much power in this room and what you just shared, thank you. Thank you for speaking life. I know there are folks on this call that needed to hear that. So I just want to say thank you. Thank you for speaking your truth, for empowering us all and giving us those words, those action words. So my first question, I was getting all, look, my question for you, Andrew, is, Andrew, in your leadership role with the Seattle TGA HIV Planning Council, you've been really instrumental in giving voice to the service needs of people with HIV, as well as helping to allocate Ryan White Part A dollars, as you mentioned, to address those needs. As we navigate the post-COVID landscape, I'd love for you to share what service needs you see that are critical and how the council might be adapting its approach to address HIV/AIDS stigma, especially within our communities.
Thanks. So I will start with the needs after COVID. Um, one of the main needs was access to health care services. So we've been able to put language in our system of care to cover telehealth. But we've also been able to define telehealth as not just a phone call, as any form of consultation that is not in person. So it covers Zoom, phone calls, text messages, anything that a patient will be billed for, because we realize that post-COVID, people are still vulnerable to the medical part, the health system. And then another major thing we noticed, and it was brought up, is the financial impact of COVID and housing. And the and it was very severe. We had nearly 14,000 people who required living with HIV in the area that required housing assistance. And so we saw that we had people that were about to lose housing. So housing still is a massive issue in the state as a whole. So, but we were able to put lots of funding in two types of housing services. We have emergency housing services where it's a one-time deal, and we have housing services where we help people transition into affordable and housing stability. And one of the other thing we did was we increased our family poverty level threshold from to 500 FPL, because we realized that, especially in the city like Seattle, people might earn a lot, but by the time you add what they pay for, they are barely surviving. And a lot of people fell out of receiving services because they were just right there at the threshold of the FPL. And that's not service to the community. And so we increased our FPL to be 500, 500 FPL. So 500 family poverty level is 500. And then the second part of the question is what next? About stigmatization. It's a huge thing is we are trying and we keep doing to meet one. We have our HIV positive caucus commit open to everyone that meets every third Thursday of every month. And we started moving it all around the area to various parts of King County to have people come. We've hosted random like picnics and shows, and then to also meet with community organizations on the need to educate about HIV, from getting tested to the stigma for people living with HIV, especially in the Black community, where it's still a taboo to talk about it. And we are doing the job, and we're putting money where it's needed.
That is beautiful. Andrew, thank you so much for your leadership. Thank you for sharing. Thank you for your vulnerability. We are so honored to have you with us today. All right. Well, we are going to transition over to Kurt. Kurt, it is such an honor to have you with us. I'm going to make sure. There we go. Kurt's coming to our stage, our virtual stage here. Awesome. Welcome, Kurt. So I would, again, love for you to share a little bit about your background, but also want to lean into how you see, I think the pandemic highlighted a lot of disparities in healthcare. And I would love to see how you see healthcare being influenced by the disparities that we saw in COVID, and what's next? What's next? What does that look like in terms of how we're supporting our folks that are experiencing HIV and AIDS?
Oh, okay. Well, to give you the short version of my background, once again, I've been doing this public health specialty active service for over 15 years, roughly. And I was actually someone that was in community that was utilizing services because I was in college. I was a broke college student, and I saw an ad that said community researcher needed $500 a month. So I went for it. Didn't know what I was getting into. I just saw $500. Upon getting into the actual info session, I then realized that public health was just a vast zeitgeist of so many opportunities. I didn't know it was just so many things you could do with it, so many opportunities that lied within it. So I instantly just kind of fell into it. And my mentor at the time, and still is my mentor, Dr. Jamar Haley, introduced me to Dr. Stefani Lee Wallace, who has since now passed. Those two were the two integral folks that really helped shape a lot of my interest, a lot of my professionalism, and guided me through the field of public health. And so I first started doing a lot of community engagement, and then it matriculated into more program development. And then eventually it kind of became a mixture of everything that you would think of. And so then it went from prevention to treatment, then prevention, then back to treatment. And what I was able to do was look at it from a variety of different lenses at that time, because what I saw was that there were folks that were saying we needed housing, we needed job development, we needed access to education, we needed mental health services or behavioral health services. But unfortunately, having to take those messages and anecdotes and suggestions to decision makers who are not impacted by HIV or living with HIV, the steadiness or the eagerness to get this programming off the ground was like, oh, we will get to it when we get to it, which then really let me realize that folks that are not greatly impacted by HIV or living with HIV will not really know what it really does to a person's mental and physical psyche. And if I'm someone in community that can help change that behavior, or at least bring some insight and work with them to create long and short-term goals, then I will do that. And so within that, COVID hits. And just as mentioned earlier, job security happens. Unfortunately, my job was one of the establishments that was unfortunately ceased because of funding. We didn't know how to navigate within the nonprofit sector during a pandemic. Where are we going to submit grant proposals to? What are we going to fund? We can't go outside. We can't do anything. So you're kind of in the house. And with that, it then shifted to now doing COVID work. And so now having to really sit and see how this pandemic can we benefit from the opportunity of people just staying still. So to answer your question, in that part, it gave opportunity for us to really sit and really absorb the messages that many folks have been saying, and they're not moving around or being so busy and booked that they actually can hear the stories, the anecdotes, the messages, the suggestions, to actually create purposeful and intentional programming for vulnerable populations. And it started to happen. But what we're starting to see now is that now that COVID is under control, long COVID is still real, everyone. So please get tested, make sure you get vaccinated. However, we're starting to see that the COVID dollars are starting to dry up. and that the eagerness or the support around some of these programs that were being supported in the midst and the height of the pandemic are now slowly just disappearing or depleting or not or ceasing to exist. So what we are having to now do is to actually still keep folks informed and let them know of how this is a priority need to keep these programs in existence, to keep funding these programs, to make sure that these grassroots organizations that are doing a lot of mobilization are being supported the best way possible. Being able to bring forward an array of other health disparity issues. One of the biggest issues right now that's actually impacting us is the mortality rates amongst Black and Brown women throughout the United States, and how they're experiencing a lot of trauma and a lot of prejudice and discrimination within practitioners' offices, and how they're not being vocalized. And so what can we do to make sure that we're bringing awareness of that, but also what can we do to make sure that if there's existing programming that either could be grassroots or maybe one that isn't being supported formally, bring that to the forefront and be able to realize when there's opportunities to step up and step back or work alongside. And I think that that's where we have to understand where there's a differentiation between power and privilege. And that's where I feel like I've kind of found my niche, because then matriculating from doing HIV prevention and treatment work to then doing COVID prevention work, I then began to do more of diversity, equity, inclusion, and social justice work. And if you all know, a lot of that work started to really become more visible, and I use that very loosely, in the height of the pandemic. And so as we started to see these positions and opportunities come up, it became an opportunity for us to really think or assume that we can create change, but not realizing that we were still working within a system that wouldn't allow us to create those changes. And so it's still an uphill battle. With that, currently at Urban League and me doing public health and equity work there, that department was birthed out of COVID money, but now we're actually looking more towards other niches, such as doing more of women's health, looking more towards doing HIV prevention services, looking more towards doing housing services, because at Urban League, we do offer an array of services, but sometimes people may not necessarily know what we do. And so we want to kind of make sure that we're commercializing that, but also simplifying it for folks to know that we can act as that liaison to connect you with already existing organizations that do the work. We're not trying to replicate what's already being done. We're just wanting to support what's actually happening. And specifically around HIV prevention and treatment, we are currently in the development of doing our own at-home testing program. So for example, we know that there's already existing CBOs and HSOs that do a lot of very intensive and purposeful HIV prevention and treatment work. However, what we're also noticing is that there's a disconnect because there isn't popular opinion leaders that are in these spaces that are connecting them to them. So because we're not a medical institution, but we also know of folks that have that capability, we are actually going to create a referral system for folks that come to us, and they also may be able to access some safe sex materials. They could be referred to any of the nearby surrounding organizations that already do that work once they come through us. So that's still continuing that continuum of health, also still making sure that we are bringing visibility to that organization, but also letting folks know that this is a safe space that they can access those services. But and in this, I could definitely say that when it comes to other health disparities, one thing that we have to remember that they all are intersected in some way, shape, or form, and that with that intersectionality, we have to now think more innovative when trying to create programming to ensure that vulnerable populations are receiving what they actually are asking for and not assuming. And so when I say bring people to have a seat at the table, actually listen to them, actually allow them to be able to tell you, what does HIV care look like for them now, not 20 years ago? What does prevention look like to them now, not 20 years ago? What are some things that you may want within your care setting? For example, maybe some positive body positive language, some sex positive language. How can we integrate faith-based organizations into the fold and continue to support that? And these are some uncomfortable conversations that many practitioners and many other health professionals do not want to have. But in order for us to see actual change, we have to have these uncomfortable conversations to lead to comfortable solutions.
Kurt, you dropped so many gems. Thank you so much. There is so much that we took from what you just said, and so thank you for sharing. Thank you for your voice. Thank you for leading in this space and in the many spaces that you are in. Thank you again for being with us today.
Not a problem.
Thank you. All right, we're going to transition over to Ernest. And Ernest, again, similar to the other speakers, if you could share a little bit about your background, but also we would love to know as, uh-oh, as we think about beyond the COVID era and what challenges and opportunities we're seeing, I'd love to know what are some of the challenges and opportunities you see in addressing the stigma around HIV/AIDS.
All right. Yes, absolutely. So I've been doing HIV prevention for this is my 26th year. I started here in Spokane back in 1998, when it wasn't one of those things that in our community, it definitely it barely talked about now. It definitely wasn't talked about back then. And so, really taking those opportunities to really trying to figure out how do I maneuver as a gay Black man in a predominantly white city, right? I went to an all Black high school. I'm from Seattle, born and raised. Went all the way up through college here in Seattle. And so it really was an eye opener for me to really get with an agency where I saw folks like me and they were all Black and brown, right? And it really felt good. It felt like I was a part of a community that I could finally start breathing, right? And so I think transitioning over the years, going from Seattle to LA to spending most of my time in DC for 17 years and then going to Atlanta and then coming back home to Seattle, right? I saw the how things matriculated and things that we were talking about, what was working, what wasn't working, and then how do we make sure that as we continue to grow and learn, we go back to those things and then really look at what was working and why was it working, and then making some edits and some modifications around how do we improve things over the years when our rates are continuously rising, but everyone else's rates are going down, right? And so, and trying to figure out why is that, and so I think it really made me work even harder and want to stay more invested into this community work that I'm doing. And I've been doing it, for so long. I think what I always have to tell myself when I wake up every day and go to sleep at night, I'm Black. When it's all said and done, I'm Black, right? And then there's nothing that I can't change that. But what I can change is the negativity and then the things around me that are affecting me because I can change my beliefs, how I feel, right? And start, owning those things around what's happening in my community and really addressing those types of things. I think for me, it was start talking to your friends and your family around how these things are affecting you and how it makes you feel. And then dealing with the uncomfortability around them. Sexuality was one thing, right? But then bringing it home and it being in their face is another thing, right? But then going out in the community, having to still hide it, right? Seattle wasn't one of those places that you could step out into the community and be who you really wanted to be. We could, but it wasn't a safe space. And so over the years, things started to change, but it's still now, I think now it's still a whole lot of people who are, really afraid of living their truth because of the environment we're still in, right? Monkeypox didn't do, I mean, monkeypox and COVID didn't do anything but make things worse for the community of color because we already were struggling with the health systems that was, really diminishing and not helping and not providing the services that we wanted, especially when it comes to cultural sensitivity and inclusion, right? We're still dealing with all of these social determinants of health and not being addressed. They're not being addressed. What they're doing is they're pacifying agencies, giving them a couple dollars and shooing them away, opposed to saying, how do we put money out there that brings agencies and community together and we address this as a unit, right? The problem we're facing is that we're siloed. You have all of these people here, they're giving money's here, money's here, money's here, but none of the money's connecting. And so we're not talking, we're not pooling our resources together. Because one of the things that is for sure is that if we ever pull together and come together and become one voice, we will be a storm to reckon with, right? And then they will have to answer some questions. And how do we do that, right? And I will say, with all of us here, even on this call, like really looking at how do we start stepping back and February is not, we're not only Black in February. We're Black January to December, right? How do we, as folks of color, get together and start really looking at putting all of our biases and issues aside and look at the cause, right? And start addressing the cause of why we are always the last to get, to see, to do, and get supported on anything, right? And supporting each other. How do we start talking to each other, start communicating better, and stop waiting for white folks to do things that we know that need to be done, right? We know money is an issue. Money is a big issue. But guess what? Seattle got a lot of Black rich people. Seattle got a lot of lot of rich brown people, right? So how do we start nurturing relationships and getting folks to have those types of things, come together, and we really have in our common goal, we can support each other, right? So there's all these different fights in our community. If we're fighting them together, we can see we can make some waves and make some pavements and really start doing some really good positive things in the community as a unit. We're purposefully segmented and we're purposely separated for a reason, because then reality says that these things have to be addressed. And these folks are starting to ask, where's this money going? And why is this money of color over here in this white agency? And why are the Black agencies only getting, not even a quarter of the money that's supposed to be driven for that community, but most of it's going over here into this other community, right? The other thing is access to it, right? When it's put out in the community, who knows about it? Nobody. And that's for a reason. Because if there's $20 million out here for an agency for agencies of color to provide services, and only a couple agencies know about it, right? And then they fund those agencies at maybe $1.5 million, the others 17.5 million dollars is going to go back over here into this pool, right? And it'll go back over into another agency that's really not addressing the issues of what we're trying to combat in our community. So I would say that, as we're looking, especially ProCan as an agency, we're really looking at diversifying our fund. We're really looking at partnerships now. We're constantly growing, right? Now we have a diversion. We're part of the diversion program, working with the police departments that's really addressing the issues of our youth. So instead of taking them to jail, they're able to bring them to agencies like ours so that we can start addressing their mental health, their substance abuse, and any of their social determinant needs of health, right? So housing, those things that they need to survive, right? And so I think that that's what we have to look at. How do we continue to start tackling these things in our community? And I think what happens is that we have so many things that we need to tackle, and we're trying to tackle them all at once. And so we're jack of all trades and a master of none, because we can't master anything, because we're not finding any solutions. No, there's no inroad to anything. And so how do we start finding inroads and then checking things off of our list? These are the things we tackle. We're going to continue to tackle this, but we have some solutions and some resolve. But these things we're starting to work on, and we're start inching up the ladder of making sure that we as a culture are banding together and we are driving those things. We do want people to look like us that are providing those services. We do want people to look like us that are being the voice for us.
Yes, thank you so much, Ernest. There's so much that you said that it was just like note after note after note after note. And so I just wanted to say, I know I saw so many responses in our gallery where folks showed you love, folks appreciated what you shared. And I just wanted to say thank you for your leadership as well. It is so I appreciate the space that we have here to just amplify and it being a safe and courageous space for us to share resources, share what's going on, share and give voice to our experiences. And just again, thank you. Thank you for being here. Thank you for creating space. Thank you for amplifying your voice and so many other voices. All right, we are going to close out our panel discussion and close out with our amazing Araya. Araya, again, I would love to hear a little bit about your background as well. And the final question.
Really quickly, Christina, Araya.
Yeah.
Araya.
Araya,
Yeah.
thank you, thank you, thank you. I'm so sorry, Araya.
You are
I'm so
fine. You are fine. You are fine. It is a pleasure to be here in this space. So my name is, I didn't do this in the beginning. You actually asked something of me and I didn't do that. So this is on me this time, okay? My name is Araya Janae. My pronouns are she and her. And I'm so happy to be here in this space, in this conversation with you.
Thank you. Thank you. So we want to learn more about you. And we have one question for you. And the question after you share more about your work is how vital do you believe the community support is in navigating HIV and AIDS? So that's my question for you. But look, this is your portion.
You know, it's actually crazy how ends up being my question because I think back to Montgomery, Alabama. So in 2000, I want to say 17, at the present moment, my date is not coming to me. I was working for CVS. I was in management at the time, but I was working for CVS. I was in training to become a pharmacy tech. Like I was like, hey, I found something to do. I'm a singer. I'm a songwriter. I've been performing since I was 5 years old. So I want you to picture at that time this small town person who was navigating what it was like to become a big fish in their little pond, right? And I got a phone call one day from my mother that told me to go to the local primate because my results had come in and they couldn't get in touch with me. And because everyone knew my mother in this small town, they knew exactly who to call next. So she calls me, she tells me to get my results. I go into this waiting room, I go into this space. They bring in another community member. And as they walk in, keep in mind, we're still in Montgomery, Alabama, specifically a city called Wetumpka, Alabama. And I want to tell you that it sounds just like it sounds, y'all. You know, it sounds like the South in the experience. I'm already Black. I am openly queer. And now I'm hearing the words that I'm HIV positive, right? And I have 15 minutes before I have to still clock in. I have to still go to work. I have to still make my money because I have to still pay my bills. But something in me understood that in this moment is too heavy for me. Where can I go where even though the shame that I feel, because that's what I felt, because that's what stigma does to us. That's what was taught to us. Those 3 letters were taught as if it was leprosy. Those 3 letters are markers, right? You know, you were taught about these letters. You think about songs like TLC and Waterfalls. You know what I mean? You think about the stories that have been passed on through generations in Black families and brown families and Southern families and Christian families and hyper-religious families. We think about these things and these experiences. And I needed someone to call to be safe. I had 2 options. I had to call my mother back because I knew she already knew something was going on. I couldn't hide from her. I had one friend that I was comfortable to call. So I talked to 2 people. The drive typically takes about 30 minutes from this pri-med to my job. I talked to 2 people, and that 30-minute drive became a 15-minute drive. I don't know how I got to that light so fast, but I realized that I had ran out of time of feeling because I had to go back into the motion of the things and I had to go accomplish the job and do the things and show up. And that was the first 4 years of me being a person living with HIV. And so I would walk into this one space that I could get medical help from, and I would sit across from people, and sometimes it would be someone that cared, and then other times it would be someone that fussed because I struggled with adherence. And my life had changed, and no one taught me that I had to be taught how to live a different life. Fast forward some time, I transitioned very publicly. I worked in public relations, just as we spoke about earlier. That career ended. It ended. It was time for a transition, and I was called to Seattle, Washington. Honestly, for ministry purposes, I pastor a trans saints ministry here with Liberation United Church of Christ. And growing up in the religious sector, I'm still talking about community. I hope y'all hear that right now, right? Like growing up in this religious sector, another piece for a lot of people, depending on where you're from or your culture. Your religious space is a piece of your community, your upbringing. And a lot of people of queer experience have been ostracized from this space. We were told we couldn't come in here. Something was wrong with us. We couldn't be here. And I found a space that I could not only show up in, but I can show up and serve and be loved and to serve others. Right. And so this is what's happening in real time. Now, this is with us fast forwarding. There was a whole gap where I spent 3 to 4 years in essence by myself in this fight with this disease that I technically might not be able to beat. Wow, that's a reality that we have to look at every day. But every time that I wake up in the morning, and when I moved here, I was working, like I said, for Pocan, and I got to go work with people who who whose experience I knew and who knew mine and who I can be accountable for and accountable to. Right. And this is what this community thing does, right? We come into the space, we're served by the space, we serve the space, we bring somebody else in so they can come into the space, be served by the space, and then they'll find a reason to serve the space. Each space is not a different organization. The space is this thing called community. The space is this thing called community. So when asked the question how influential and important community is to this, we cannot do any of this without you. We need us to keep showing up to these conversations. We need us to keep coming into the room and asking questions. We need to be educated. We need these things. And ultimately, if for nothing else, in every one of these nonprofits, there are people that are doing this for their living. Go see them. Community. Let's be community. And then when I get there, I might grab something that you might need. You might hear about a food resource. You might hear about testing resources. You might hear about something that can go back and help somebody really close to you. I wonder what would have happened if I never would have gone in the room. I wonder what would have happened if I never would have gotten to experience someone fussing at me because I couldn't get it right. Would I have walked into this season, into this space, and I would be frustrated because I would think, oh, you don't want to live? Those are words that I've heard from the other side of the table, community, right? No, what it made me say is, let's figure out the whys. Let's figure out what you need from me. Let's figure out what I need to learn from you, right? Because in this thing called community, until we are willing to show up, to be served, and to serve, and to bring someone else in, we can't get the flow of things right. And this space only works when we get it. The flow of thing has to be right, you know? So currently I'm working as a community counselor for the Lavender Rights Project. And the added on dimension of this, and I don't think that it's talked about a lot, but I heard this several times when we talk about representation. And I think about Andrew. I want to tell you out loud, I love you, my brother. And I thank you so much for your vulnerability, your transparency, and for setting the tone for truth today. I stand with you and I tell you thank you. And I said that because I want us to understand that what I do in my job every day is I get to help connect community members to something called the Black Wellness Nexus. And what this is a resource guide that intentionally finds organizations that are safe for the marginalized, people of color, Indigenous folk, we're talking about our Black folk, we're talking about people that are typically left out in the margins. You know, we have a whole lot of programs that say they're for, you know, certain demographics, but at times when the funding's gone, the funding's gone. If we can't get the people with the money to respond, organizations can only do so much. And so there is only so much our reach gets to. So let's find out where all the reach is. Let's find out where all the safe space is so that when we grab community, we take community where community needs to be so that not only are they taken care of, but their holistic care is taken care of. In this thing called community, we can't just focus on the fact that I'm HIV positive. We also need to focus on the fact that before I got here, I was chronically homeless, technically, right? So that's a thing. That's a thing that has to be addressed because until I learn new practices on how to budget, do you hear what I'm saying? I won't. That's holistic care, and we can't do it alone. But there are some of us that are really good at finding the resource, creating the programming, taking people through training classes. We need each other as organizations, as community members, as religious entities, as just human beings that are waking up and dealing with the same thing, baby. Trying to figure out how to make it through this thing called life in systems that were not built for us. So, when we talk about community, community is not just needed and necessary, it is vital and it is the only missing link. There are
Wow.
people all over this country that are doing the work when it comes to research. They're doing the work when it comes to finding the money. I worked with them. Kurt Reagan, people like Kurt Reagan, Ernest Walker, Stephen Sawyer, Jalen Scott, Ebo Barton. We're talking about Deontay Damper. We're talking about Ashley McGirt. We're talking about these people that are doing this work, y'all. We're talking about Diamond Collier over in Texas. We're talking about Vernus and the Mahogany Project over in Texas. We're talking about people that are doing the work, y'all. Over at TKO in Selma, Alabama. We're talking to people doing the work. We need community to come out and be a part of it with us. We need people that don't mind coming and grab some pamphlets and taking it with them. This is how we're going to help, not just educate, but free ourselves from stigmas that have left us in the margins and in darkness.
Oh, thank you so much, Araya. You are such an outstanding leader. Thank you for reaching into all of us today and speaking to all of us, giving us some things that we can, at the end of this call, none of us, I would say, I'm going to speak on behalf of everybody. None of us, I don't think anyone coming off of this call can say, I don't know what to do next. I think you gave us quite a few calls to action. And now it's our job to take those calls, to pick up and support and walk with each one of our amazing speakers on this call today to support you in your work. When we think about funding, when we think about programming, when we think about resources, when we think about community-based outreach, this is Araya, you gave us so much to work from so that we can build upon so that over the next few months, over our time, we have some progress to make, right? And so thank you for sharing, thank you for your leadership, thank you for your love and how you pour into community. Well, thank you all. I am going to transition over to Christian Bell, but again, just wanted to thank our amazing speakers. Oh, Deontay, I see you. Deontay, were you going to share?
Oh, I'm not sure if I was going after the small discussion. I was just clapping because Araya just brought it home. So, Christian, I think I'm after you.
Yes, Deontay, we will have you share some closing thoughts after I get these resources through. But whew, sorry, you all. That was just so powerful. I'm just so filled with joy. To our speakers, thank you so much for being vulnerable in this space, for sharing your resources to the community. You all mean so much. So thank you. Um, I'm so excited to share with you all some exciting resources that we have just available. And each one that I talk about, we will be sure to drop the links in the chat, as well as we'll be sending out our resources in a newsletter early next week. So the first segment of resources we'll talk about are HIV and AIDS resources. This one is called the HIV Community Services Program. So the Washington State Department of Health HIV Community Services Program addresses the needs of persons living with HIV by funding case management and support services that enhance access to and retention and HIV medical care and treatment. And if you'd like to learn more information about this program, what they do, we have provided the email as well as the phone number, and then we'll drop the link in the chat for you as well to learn more about their area of focus. The next resource or what we'll be sharing today is the Early Intervention Program, EIP. So this is the Washington State's AIDS Drug Assistance Program. It helps folks that are eligible living with HIV get medical care and support to improve their health. Again, we'll be dropping the links in the chat, but you'll see the email that you can reach as well as the phone number to call. The next resource that we'll talk about today is the Pre-Exposure Prophylaxis Drug Assistance Program. And this is a drug assistance program for HIV negative people who have risk factors that expose them to HIV. So if you or someone you know that might benefit from this program, we have dropped the contact email as well as the phone number, and we'll link that in the our chat box. The last resource we'll share today, just regarding HIV and AIDS, is the housing opportunities for persons with AIDS and HIV. And this is a federally funded program. It's dedicated to meet the needs of housing, to meet the housing needs of low-income persons living with HIV and AIDS. And services are provided based on each eligible household's needs to support housing stability and improve their access to healthcare and supportive services. Again, the email as well as the phone number to call is available on the screen, but we'll drop this link in the chat if you'd like to learn more. I'll now move into some COVID-19 resources. So the first COVID-19 resource that we're sharing today is just what to do if you've been exposed to COVID-19. So the first thing you want to do is you want to get tested. So get tested 3 to 5 days after your last contact with the person with COVID-19. You'll also want to wear a mask. Wear a high quality mask or respirator around others at home and in public for 10 days after your last contact with the person with COVID-19. And next, you'll want to check for symptoms. So those symptoms include fever or chills, cough, shortness of breath or difficulty breathing, muscle or body aches, new loss of taste or smell, sore throat, and congestion or runny nose. And if you tested positive for COVID-19 or been exposed, we'll have a link to the chat so you can get those DH resources. Our last COVID-19 or second to last COVID-19 resource is the Department of Health unveiled kiosks that offer free COVID-19 and flu tests. So some key notes about this is that these kiosks are free to local health jurisdictions and tribal communities. DOH will cover costs associated with COVID-19 and flu tests. These kiosks will hold about 700 tests. And another thing to note is that local health jurisdictions and tribal nations can choose to add other essential healthcare products to the kiosks at their own cost. So this could be Naloxone, it could be pregnancy tests, tests for sexually transmitted infections, fentanyl test strips, and other over-the-counter medications and products. And if no additional products are added, kiosks will be filled with those COVID-19 and flu tests. I encourage folks, if there are any questions that you have about these kiosks, please feel free to do that in the chat, and then we will uplift that to our DH partners and get more information out to you. I'm going to move into some closing thoughts with Deontay Damper, and I thank you all so much for your time.
I can't say enough how fire that panel was. When we are talking about surviving stigma, when we were actually thinking about this event, we wanted to make sure we prioritize this in February because we wanted to make sure that we were centering. We wanted to make sure we're having continued conversations about the disparities in our community. And we couldn't think of any other fire panelists. Andrew, over the years, I've watched you continue to be the first openly positive person to run for state representative, first openly positive African-born person on the areas of the LGBTQ commissions. You, sir, are continuing to strive and be the first, creating conversations. And I've watched you walk in these communities and be vulnerable and then not be sure. But now you are so sure. You are so ready. And I'm so happy to be walking along with you with surviving this stigma. Araya, I've watched you move here from Montgomery, Alabama, and create a lane for not only yourself, but you take community with you from your passion and how you pour in the love that you are when I talk about community, you are a part of the heart of the community. I'm so happy to call you sister and continue to watch you flourish in any position that you got. And I say any because we know they're going to keep on going. Kurt, over the past 4 years that I've seen you come into this community, you've seen the table that was set and you built your own. And not only are you building your own, you're also telling the guests that come here, you say what you need. And you are creating space for so many queer, non-binary, cisgendered, hetero community members. You are bringing them to the table so they can learn how to take care of us. And you have to be, if there is any area of the body that you are definitely the lung of this community with surviving stigma. And we appreciate the work that you do. Ernest, I can't say enough who you are to community, to you nationwide with it. And you came back and are breathing back life into prioritizing not only HIV, but you are making sure that we are prioritizing it, taking it back to the old days when we are generalizing it. We're not just making it an LGBTQ conversation. This is a everybody, everything conversation. And yes, Black first. All of you are a part of the community compass to wellness. You are helping us reclaim wellness. You are elevating Black wellness, and you are eliminating the barriers from your stories that you shared with us today. I can't tell you enough how grateful I am for you, all of you. And on a personal note, my 2020 in COVID was not good. I ended up leaning backwards and not really having a real big identity crisis. And there was a point in time over the past 3 years where I reached out to all of you, and you encouraged me. Some of you encouraged me to learn how to show up for myself, but I couldn't do that without the heart, without your hearts, and without your leadership. We are surviving stigma together. And I thank you all. And above all else, I want to also make sure I make this clear. We're just not here to give you our stories. These are community organizers and they need funding. So if you can feel free to email us, we will give you their email. There's For the Culture, there is Seraphin, there are some of the POCAM programs that are going on and need funding. We need funding. We love to tell our stories. We love to let you know about surviving stigma, but we can't do that without equity. So if you know of any doctors or anybody putting on different events and need that navigation or need assistance with learning that, please fund these speakers. They need it. They need it so they can continue to pour into community and also pour into themselves. And that is surviving the stigma. Surviving the stigma is also equity. So I just wanted to make sure I threw that in. I'm so happy for, of course, Ashley and the Blocker family, Momentum, Elevate Black Wellness. Kristen, we've been working on this for 4 months. I love you. And Vocal Washington, of course, our ASL interpreters. Billy, you are interpreting, brother. Give it up for Billy over here. You did that, brother. I just want to I just want to thank everybody for being here today. And don't forget, we got the Reclaiming Wellness in July. Make sure you get your tickets. And we got our Elevated Black Wellness Week. Thanks to the governor for the shout out. But I'm just so happy to be sharing the space. This is Black History, and we will continue to go into the future with surviving stigma. Thank you. And we're gonna leave you with the song "Stand Up." We want to thank everybody for being here. This is "Stand Up" by Cynthia Erivo. Okay, I ain't never heard this version, so this should be good. But in the meantime, put your thank yous in the chat. Make sure you're inboxing people, letting them know how you can reach them. We're gonna continue to elevate Black wellness. Ain't that right?
With my face turned to the sun.
Thank you all.
Oh, so much.
On my shoulders, a bullet in my gun. Oh, I got eyes in the back of my head, just in case I have to run. I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones. Early in the morning, before the sun begins to shine, we're gonna start moving towards that separating line. I'm wading through muddy waters. You know I got a made of mind, and I don't mind if I lose any blood on the way to salvation. And I fight with the strength that I got until I die. So I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. And I know what's around the bend. My
Thank you so much, everyone. Be blessed. Thank you for your time. And we wish you all the best as you go into the weekend. Thank you.